from a physique standpoint, you just destroyed it. You kind of started looking like this. Definitely a little bit ragged. And you seriously ripped here. It's unbelievable transformation. And I was really, really impressed with your progress. Hey guys, it's Dr. Ryan, and today we're talking with a patient of mine, Daniel. Daniel's been a patient of the clinic for close to a year, and he's going to tell us a little bit about his experience working with myself and SummaUp. So Dan, why don't we start out by having you tell us a little bit about yourself, where you're from, what you do, some of your hobbies, and your family.
My name's Daniel Young. I'm from Savannah, Georgia. My hobbies now are meal prepping and working out. It used to be overeating and traveling. I still do the travel. And I'm an ER physician.
Very cool. Dan, why don't we go ahead and get started with asking you to kind of recollect how things were prior to starting with SummaUp. What were some of the goals that you were trying to accomplish in terms of your physique and your overall health? What were those goals?
I was scrolling through Facebook, which I used to do a lot of, and I had been on HRT since about the age of 38. I guess when I started, it was like once a month injections. And then I think when I started Summa, I may have been doing it bi-monthly, but still just kind of inefficient. And then my mother passed away in 2021 of Alzheimer's. And I started to research, and my dad had prefrontal dementia. And I started looking at longevity, and I started Gary Brecka and all these names in the longevity space and reading what they did. And some things, my background, of course, is medicine, and I have a master's in biochemistry. And I was sorting through all this data, and some of the stuff they were saying is like, that doesn't make sense. It's not true. And then others of it was, and it was good. But then I started digging into the research, the study, and completely became overwhelmed. I work 72 to 96 hours a week, but I don't have time to pour through all these studies and discern, is this an acceptable study? Was this industry sponsored? What's the sample size? Great enough? What was the p-value? Is this? And I should probably get help with this. I should go to a real anti-aging doctor instead of me trying to manage myself. They say if you're a physician and you're treating yourself, you have a fool for a patient. So I came across that on Facebook, and I listened to it and decided to do the intake. And I was impressed with kind of the results, some testimonials, and the approach to it. I had all these ideas and goals and plans I wanted to do outside of medicine. But to be honest, I didn't have the energy. I always wanted to get into real estate. I wanted to build a community, tiny homes, and just kind of planning for things in retirement. But after working the 72 to 96 hours a week, I was just done. And then I had all these unhealthy habits like eating, traveling. I just didn't have the energy to pursue. What I found, probably the biggest thing with SummaUp is with the protocols that you put in place, with the dosing on testosterone, the supplements, is that I could work more efficient with more energy, see more patients in a more efficient manner. And then when I was off, I still had reserve to pursue those passions. So I went from buying my first house at 48, and I turned 50 this year, and I'm closing on my third with plans to build 4 more on there. So within this year, I went from 1 house to 3 in like 12 months. I have more mental clarity, more mental energy, and more physical stamina to accomplish goals that I didn't have before.
That's huge. And I'm really happy that the protocols, the meds, the supplements, the diet, and the exercise allowed you to achieve that. Before we go on to what you saw personally, I do want to kind of brag on you. I have been just super impressed with what you've been able to accomplish, Dan. So when you came to me, we had kind of talked a little bit about your lab values and how you want to improve your homocysteine. I kind of read about that, and let's take a look at that and how that changed. Going through the protocols for the clinic, when you came to us, your homocysteine was 10, which isn't incredibly unhealthy, but just not optimal. We really wanted to see this closer to 8 and below, and you're able to smash through that barrier and get that down to 6 within a fairly short period. Really just about 6 months. Your apolipoprotein dropped from 93 to 87. It was good to start, but it got really good. Your triglycerides dropped from 116 to 83, which is excellent. Your lipoprotein A always stayed pretty good, which is great. Your hemoglobin A1C, which was really good at 5, got really, really good at 4.5, 4.7. And then your VLDL, that mark of atherosclerosis, and some physicians think is more indicative than LDL, improved from 24 to 16. So I was really, really happy. And from a physique standpoint, you just destroyed it. Our goal was to kind of cut down and then bulk up, and you went from 169, we kind of leaned you down to about 147. You're like, all right, Dr. Ryan, I got to put some muscle on. And so you kind of bulked up, and it was really good. And the pictures are just remarkable. You kind of started looking like this. You kind of fit, but, definitely a little bit ragged. And as you working 72 to
Pudgy.
96 hours, it's tough, right? But seriously, ripped here is unbelievable transformation. And I was really, really impressed with your progress. So outside of the biometrics and of course your physique, what were some of the things that you noticed personally?
First off, I still like to travel, and I typically go to beach resorts. So when I used to go to the pools or the beaches, I was always just keeping my shirt on because I knew I had this big beer gut. And so it was really cool to go to the beach, to be shirtless and be proud. I just enjoyed clothes fitting better, even scrubs. It's hard to look attractive in scrubs, but filling them out and going down in sizes and being proud of the gym, to wear like a muscle shirt or something. Having that energy, with my son and setting a good example to him of you should be eating healthy. You should be working out, building that muscle because it's going to carry you far. The respect people give when they see the discipline you have, fulfillment and gratification that you have when you achieve a good physique, and what that kind of conveys in the message of here's somebody who has the discipline to follow through with what they say. They're willing to do hard things and do it on a consistent basis. And I like that message. And I like to show my son, not just tell my son, you need to be disciplined. You need to be fulfillment gratification, put off things and deny yourself so that you can have a greater result.
Yeah, kids, I think, are a great mirror of their parents. And I'm glad that you were able to model some very positive, some very healthful behaviors that you'll kind of internalize. And the other aspect is, and I noticed this being a physician myself, we're supposed to be a paradigm of health, but oftentimes due to crazy schedules, credentialing exams, stresses, both in and out of the hospital, we tend to put our own health, let it sit by the wayside versus, concentrating on our patient's health. And it's really nice when that doesn't occur. And I'm sure your patients probably notice that too. They're like, oh, wow, this is a fit doctor. And all doctors should be fit ideally, but you probably notice that you're kind of an exception, I guess, sometimes.
Right. It's no longer do as I say, not as I do. It's do as I say. Let me tell you how. And I'll tell patients what I do. My diet now, the high protein and cutting out sugars and a lot of carbs. And I have much better understanding having experienced it. And I convey that with my patients. I tell them, hey, this is what you need to do, your BMI, you need to get this down. And these are the ways you need to do it, instead of just what I read in a textbook.
And people experience that almost viscerally when you live what you're saying. When you're like, hey, you ought to follow a diet that's free of gluten, that's lower in carbohydrate, that uses lean proteins. And look at me, I do, right? And I feel amazing. It allows you to convey the message in a much more strong manner. What are some other changes that individuals that you're close to saw? Family, friends, colleagues?
I set a good example for my friends, and a lot of them have asked me, what are you doing? How'd you do this? Even the nurses I work with are, what happened? Because they, have known me for years and they saw the transformation. And so I've kind of become an advisor for a lot of them, male and female. Just more energy with my girlfriend to do more physically active things. We take walks, we ride bikes, hiking, paddleboard, canoe, kayak. Like our vacations are more active vacations, snorkeling, zip line, scuba dive, whatever, as opposed to just kind of sitting around feeding our faces at the all-you-can-eat, all-inclusive. And there's really not an aspect of my life that hasn't changed because of my health.
That's wonderful. You talked about a lot of benefits and a lot of benefits that other people around you have noticed. Is there anything that you haven't noticed or that you haven't mentioned that you've obtained from working with myself in the clinic?
I feel like a different person. Like I'm healthier now with more energy than I was in my 30s, and I turned 50.
Well, Dan, to sum things up, what would you tell someone who is watching this now and is uncertain about joining the program? What would you tell that individual?
Seeing it on Facebook, you're like, is this a scam? You don't know, and it's expensive. And to put that kind of trust, I felt like it was a gamble the first month or even two. I'm like, wow. To be honest, my goal was, hey, I'm going to do this for like 3 months. And to see what it's about. Here I am 10 months later, still going. I don't know, it was a leap of faith, I guess, just because, I didn't know you, didn't know about SummaUp. I could read about it, but I took the gamble and I'm so glad I did.
I really appreciate you saying all of those positive things about the clinic, and I really, really appreciate having you as a patient, Dan. And thanks so much for sharing your experiences that you had with the clinic over the past year.
My pleasure.